from business model, which we talked about in the last session with Brian Thompson, to a business plan. And then from there, how do you do financial projections? And my passion and interest is in healthcare and health tech. A lot of times I'm working with scientists, and sometimes scientists kind of recoil a little bit at the focus of money. Although I think every scientist in here is a little bit entrepreneurial. So hopefully you see the balance, but it's about solving a problem, and it's also about making money. And I like a quote from George Merck, associated with Merck Pharmaceuticals. Business is, of course, about making products that address a need in society. And those products could be pharmaceuticals. But this quote from him: we try not to forget that medicine is for the people, it's not for the profits. The profits will follow, and if we remember that, they never fail to appear. So I think if you're focused on making something that the world really, really needs, you will make money. And so it's kind of important to keep your focus there. I've dealt with a lot of venture capitalists, and yeah, they're about making money, but they really are about coming up with something that is impactful for the world too. So they kind of go hand in hand in my mind. Some books that I would recommend for folks, if you don't have the mom test, I have a free copy for you. For those of you that are here as part of the boot camp, take a free copy. For those of my students that want them, I can bring some more for you as well. So, although I think most of my students are going to SEAL Launch tomorrow, and I'll have books there as well. So the mom test is about how to do customer discovery, which is a kind of market research as well. Technology Entrepreneurship is a great book if you're science, engineering, tech. It covers everything from intellectual property to business model, corporate forms, C Corp, LLC, that kind of thing. So I recommend that as well. And then I have kind of an overview of the structure of the business plan, and there's a nice Harvard Business Review article that covers that. I cannot give you a copy because Harvard is extremely strict about their copyright law. I'm afraid of that. This is where you find it. So it's a nice article. So before you think about a business plan, you have to think about the business model, which is more the creative part of your business. So at the simplest level, according to Peter Drucker, who's kind of a business guru, it's about identifying who your customer is and what their needs are, and basically the value proposition for the customer. So those two things, product market fit, may seem obvious to you, but it's sometimes good to reflect on the obvious, and how to do that at a reasonable cost. And then, of course, really the tricky part, and what we really focus on a lot, is how do you make money doing this? And that's useful to think about whether you have a drug, a diagnostic, software, kind of what's your revenue model? Because there are a lot of different revenue models you can have for all of your businesses, and you got to think that through. And it could be the difference between success and not. So, for instance, I know Dr. Shakir, Reza Shakir, had a device to help with esophageal reflux, and there was a big debate about whether it should be by prescription only or over the counter. I don't know what that business is not continuing, and I'm not saying that the reason it didn't is because of that, but those kinds of decisions is how do I structure my business model could cause your company to sink or swim. So it's important to think through the best revenue model for your company. According to Joan Magretta, another guru in business, the business model is just the story of how your business works. So if you talk about the elevator pitch, 2 to 3 minutes to tell somebody what your business is about. You're probably going to talk about what problem am I trying to solve? What's my solution to that problem? And you should probably talk about, how I'm going to turn this into a revenue generating business. Nice video by Steve Blank. Steve Blank has a whole series of videos about business model. If you're interested in using the business model canvas to develop your business model, Steve teaches a lot of what you need about business model to implement the business model canvas, really thinking through the connection between your product or service and your customer. And he emphasizes how important it is to focus not on the business plan, but the business model. Because you can write a business plan, just isolated in a library, disconnected from the world, and it could be a beautiful business plan about a horrible idea. So you have to spend more time thinking about your business model. And then it's just a matter of turning the crank to write a business plan around that business model. So he wrote a book, great book, Startup Owner's Manual, which I'd recommend as well. So the first step, like I said, is the business model. And you can use the business model canvas as a brainstorming tool to help you develop the business model. And there's a book, Business Model Generation, by Alexander Osterweiler, who talks through the business model canvas and the different sections of it. And really, where you start is with the customer segment. Who is the customer specifically, and then the value proposition. What problem are you solving for them? So here are just some examples of the business model canvas. When you think about your customer segment, you might sometimes want to think about, do I have more than one customer segment? So if you think of like a simple example of Google, you know, obviously we're all thinking of Google as a nice way to do searches and find things on the internet. So the user, the internet user, which is pretty much everybody in the world, is a customer, but they're not paying anything. They're just using it to find things on the internet. So the other customer segment obviously is advertisers who are selling targeted ads to you based upon your searches. So that is another customer segment you focus on, advertisers, and then people that are developing mobile devices and platforms like that. As well as a customer segment and so on. So you can think of different customer segments that you might be targeting. And the reason this is useful is when you comes time to do your marketing and sales, you can sort of focus on different customer segments and present different value propositions to them. Another one, for those of you that are science focused, is one that I found on called Ground Floor Pharmaceuticals, which has a synthesis for fluorinated compounds that's fast and efficient. So PET scans require an unstable isotope of fluorine, F18. And so they developed a faster way to do that. So the customers for that are companies that produce radiopharmaceuticals, as well as physicians who are using these for PET scans, and then maybe also people doing drug development that want to be have a way to trace the pharmacokinetics and where the drug is going in the body, basically. So you can think of the value proposition as they're saying it gives you more pure compounds, prepared faster, and then you can use it for kinds of imaging called PET and SPECT, things like that. So this concept of value proposition and customer applies for every kind of business, including pharmaceuticals and drugs as well. As you're doing this, you have to think about what are my sources of revenue as well. You could have multiple sources of revenue. In this case, this is chemistry, so they're looking at maybe selling chemical intermediates, or maybe the final product, or maybe they license the technology so somebody else can do it and not them. So as well. So, or if somebody is producing a product that they sell, you can claim royalties from that. So for whatever your idea is, you should think, are there multiple revenue streams? Maybe some that I'm not thinking of right now. So a lot of times you're thinking, I want to sell directly, but maybe you could license it to somebody. Maybe you license it to somebody for a sub-market that you're not interested in pursuing yourself directly. So like for the VR, AR, for the surgery, I think we talked about this briefly, but you said that the educational market, medical school market is not something you are interested in. You think it's kind of saturated. Possible somebody might want it, but you're not going to pursue that. So you could license it as a side thing. Yeah. So think about business models. Tesla's is pretty easy. Selling cars, and he's selling a brand around those cars as well. So it's cutting edge technology from the guy who's going to create a space station for us on Mars. So he's selling a brand that goes along with technology as well. What's Facebook's business model? How do they make money? Steal everybody's information. Yeah. I suppose they'd say they disclosed it to us, but we weren't really paying attention to the fine print. And and then they're selling that information for targeted ads, right? So really their business model is targeted advertising. So a lot of the software type business models, you got to think, how do I monetize this? And the most common way is advertisements. Amazon's business model is pretty much just a conglomeration of everything you can purchase. So the convenience of being able to purchase anything in one place and then having it the next day. So really they're a logistics company, is what their business model is. Pfizer, J&J, pharmaceutical companies, obviously they're selling drugs and diagnostics. Some of them are prescription, some of them are over the counter. Sometimes they have to decide which and for what reason, because there is a drug there are many cases of drugs that could be over the counter, but maybe they choose to be prescription, maybe because they feel customers in Walgreens aren't going to recognize the need for this, and it's more likely that they're going to get sales if it's coming through a physician. If it's something complicated, I suppose, Joe, your test, if it could be over the counter, I don't know if it could be, because some of what you have is probably prescription, but even so, it's probably complicated enough where even if it was over the counter, people wouldn't buy it. I don't know. Do you think there could ever be over the counter use for? You're looking at phenotyping, kind of like genotyping people, right? So
yeah. So my thought in terms of over the counter would be online, and you could have a nurse practitioner just write you the order after you get a quick screen.
okay,
And they just send you the kit. So that's not quite over the counter, but pretty
close.
Pretty close. Or you could get the kit and then you have to enroll before you can use the kit.
Right.
Something like that.
Yeah. But those kind of decisions are important, and it can affect how much sales you have. So, clinical services, there's GenoPalette, which takes your genetic information. That's a company in Milwaukee that many of you may know about. She raised $4 million, I think, in December of last year. Sherry Zhang, and she's looking at taking your genomic information and recommending food for you based on your genetics. So, maybe you're diabetic and, in terms of glycemic index, but it's much deeper than that, or that's what she's claiming. And is she has a huge database of genetic correlation with certain pathologies that you could have that could be sort of lessened if you had more calcium or potassium in your diet, or fewer carbohydrates or whatever. So she can choose a lot of different business models for what she's doing. What she's chosen to do is some kind of membership model where you pay to subscribe, and then you get these kind of food recommendations. You get the initial report of, kind of recommendations for things you should eat, but then you have like a monthly fee, and they give you regular food recommendations and things like that. But you can imagine there are a lot of ways you could do that. It could be like a one-time thing and you just get the report. That's probably not a good business model, because you only get money from people one time and then it's done. She's recommending food choices. I've sometimes wondered, does it make sense? Could you connect this to a restaurant, or could you connect it to a home delivery food service, or drug food interactions? There are a lot of possible directions to go with a business like that. And then a company that I'm working with called Advocates for Healthcare provides clinical services on your phone to help you navigate direct primary care. So if you want to find a physician and you're going to pay cash instead of using insurance, how do you do that? How do you find a good physician? How do you navigate sometimes using my insurance and not? So that is on a per event basis. So you might pay $50 for a meeting with a physician, or $100. Sesame is a company, and you should check them out. I'm kind of impressed with them as well. So they help you find doctors through direct primary care as well. So it's on a kind of a per visit basis, or you could have a membership where you pay. I think I don't know how much Sesame charges, but these kind of things are maybe like $100 a month or something like that, and then you get essentially unlimited access to a physician. So that's a kind of software tools. This is the company that I said we're involved in. So you get 3 sources of revenue. So you have a patient, a consultant for you as a patient. Charge maybe $10 for a consultation for 10, 15 minutes. You could have an insurance agent that helps you figure out how to navigate when to use your insurance, when not. How do I figure out what my copay is? Most of us have spent hours on the phone with our insurance company and realize how frustrating that is. So there would be a person to help you navigate that. And then physicians that are running DPC clinics. So right now, the president of the Wisconsin Medical Society is herself a DPC physician. She's not connected with a provider. And she was joking to me that, now I got to learn how to do marketing. I'm a physician. How do I let people know that I have a practice? And so that is something to provide too. So whether you're talking about drugs, devices, software, clinical services, you have to come up with some sort of revenue model. And then you have to kind of validate that this revenue model is viable by talking to the people that you think are customers as well. So you should interview them. I know some of you are doing that. If you haven't done it, please do it. There's this whole National Science Foundation and National Institute of Health ICOR program that kind of walks you through how to do that. And the idea is to refine your business model ultimately to the point where you have a simple version of it that you can try and sell and see if people will buy it. It's called the minimum viable product. The interview process, you can use the guidance from the MOM test on how to do interviews. And then in terms of this concept of building a minimum viable product, this is sort of the Bible for that. It's the Lean Startup book by Eric Ries. And he was talking about this application in sort of a software-like company. And rather than build a whole software package out, he would build, 10 kind of simple prototypes and begin selling them before he actually had created them all. So, and then when he started to get a lot of customer interest, then he'd put the whole development team behind that. So it was kind of he did it in a way that wasn't deceptive. I mean, he intended to deliver on what he was offering the public. But the idea is you could develop, product by product by product, one at a time, and fail and fail and fail and fail, and then you hit. So the question is, how do you kind of speed up that process? And that's the lean launch process that he talks about. Yeah.
I mean, I understand the concept, but for companies like Care, how do you come up with
There's no really easy way to do it for something like a pharmaceutical, right? So there's, and even diagnostic. I mean, so then you're just kind of stuck with interviewing people, I think. Although, you could talk about, we're adding a few zeros to your prototyping here. But if there were a way to test, say it's a diagnostic assay and the regulatory path to approval, say with an ELISA, is shorter and cheaper. And you could test the market with that before you develop something more expensive like a lateral flow assay. So even when you're talking about something expensive like a diagnostic, if there's a way to test the market and then follow on with a subsequent product, if that's possible. In your case, you're developing software in a way, augmented reality, virtual reality. You could play with this, but you're dealing with a regulatory agency, so you can't, I don't know how you would approach that in your case.
Yeah. In my case, in devices and software, it's relatively easy compared to pharma.
Yeah.
I mean, I had to show to the surgeons, the oral surgeons. So I just basically took a CT of the jawbone and the teeth, and then took some screws and plates from my orthopedic module. So I was able to rig up something.
Okay.
In software devices, you can always do things like that, but in pharma.
In pharma, it's hard. Yeah. There's no easy way to do a minimum viable product. Yeah, it's much harder. So now if you're Merck or Abbott and you have hundreds of millions of dollars and billions of dollars, you can. I know that a startup that I was working on had a P38 MAP kinase inhibitor, and they were trying it for different things. They were trying it for psoriasis. They were trying it for arthritis. They were sort of testing the waters themselves. And for them to kill a $50 million project, for them, that's like a minimum viable product. So but they kill it in clinical trials. So the project that I was working on was killed, not for any scientific reason, but sort of for a business reason. So they decided the market was too saturated, and they had already invested $30-40 million. You were going to say something?
I'm wondering as far as developing, kind of a preliminary test. I mean, we're working on the potential for a diagnostic with the
initial research use product, and that serve as kind of as a preliminary evaluation for continuing on the diagnostic study, or are those two separate? Are they basically two separate courses and they can't really overlap?
No, I think there could be some overlap with that. Yeah, in my sense. Yeah. But clearly, it's a lot harder with pharmaceuticals and diagnostics. Yours is a little more achievable because it's a research tool. So, yeah. Although once you go down the diagnostic path, you look for indicators, like you're saying, so, of success. So the idea is to kind of iterate. Harder to do when your product is very expensive, like a drug. But you build a prototype. You measure how much market traction you're getting. You kind of interpret that realistically and try to remove any bias you have about loving your product or idea too much. And then you figure out, ideate about how I can tweak it, and then you build another version. You just keep iterating. So
Yes, it's just like that. I think I mentioned that to you in the classes where we go to PDCA site and plan, check.
yes,
and adjust.
kind of continuous improvement. That's what you're referring to. Yeah. Yeah, it is a kind of like Six Sigma continuous improvement applied to startups. That's a good analogy. So, and while I say it's hard to do with pharmaceuticals, pharmaceutical companies that have tremendous resources can do that. So, they try to kill it, before they spend too much money on phase 3 trials, because then you're talking $100 million or so.